Good afternoon, everyone. Here's a couple of questions on fundamental concepts, specifically the older adult. So here's the first one. The client is in the post-operative phase of an abdominal resection and colostomy. When educating the client on ostomy care by providing educational materials to read, it is important to assess the client's what? Okay, and here are your answer choices. A is hearing, B, vision, C, social support, and D, gait. And I'll give you a couple of minutes to think about this and what the answer might be. In the meantime, please like and subscribe and share my videos on my channel, Nursing with Hart, PhD, as I continue to share this valuable information. Okay, so let's come back to this question. So what are we looking for in this question? You're really not needing to know anything about the post-op phase of the abdominal resection and colostomy. Okay, what you need to know about is what's important for the nurse to assess when you're educating on a client by providing educational materials to read. Those are your clue words. Educational materials to read. What do they need? What does a person need in order to read? And they need their vision. Okay. So the answer is letter B, vision. Let's go over the other answer choices. A is hearing. Hearing is important, but it's not asking you about hearing. It's asking you, what does the nurse need to assess when providing educational materials to read? The nurse needs to determine with their assessment skills, what is the client's vision adequate enough to read the material that you're providing. Okay, letter C is social support. That's important, but not for this question. And D is gait, also important, but that's not what it's asking you. So you have to read the stem of these questions carefully. Read it a couple of times to determine what information the question is asking you for. Okay, here's the next one. When the home care nurse visits a female client aged 78 years who is recently widowed, the nurse finds that the home is cluttered with trash. The client appears sad and disheveled. The nurse should assess the client for symptoms of what? Here are your answer choices. Letter A, fatigue. Letter B, presbyopia. Letter C, drug overdose. And D, depression. Okay, so let's look at these answer choices, and I'll give you a minute. We'll come back. Okay, so let's look at the stem of the question and what it's asking you for. The stem of the question is describing a female who is 78 years old, recently widowed. That's a clue. Okay, the home is cluttered. Another clue, with trash. Biggest clue is the client is sad, appears sad and disheveled. What is disheveled? That's when the hair is not combed, they haven't showered, they're not taking care of personal hygiene. That's disheveled. Okay, and so those are all signs and symptoms of depression. So other symptoms of depression are poor cognitive performance, sleep problems, and lack of initiative. Okay, so that's it for these two questions, just two quick ones. I'm going to put together some more fundamental type of questions very soon, so keep an eye out. We'll see you on the next one. Have a great day.